welcome to my channel. My name is Ajane for those of you who are new, and welcome to my channel. I'm excited to be sharing with you guys some tips on how to document as a medical social worker, or even as a social worker in general, or a medical professional. What are some good tips in order for you to know to make sure that your charting looks good and it's appropriate and it's cohesive with the rest of the hospital and the other staff. So some of you have asked me to do more videos about social work, to do some videos about documentation. What does it look like to document in a hospital setting? And I wanted to share that with you, but there's so much information to share that I just couldn't do it in one video. I've thought about multiple ways in order to get this information out to you guys, that it's entertaining, that it's educational, that it's informative, and that is straight to the point. And I want to be able to do that, but I just can't do that in one video. It's just not enough. Some of you have even asked me for like case notes or examples on how to document, and so there'll be a little mini series. As long as you guys want the videos and they do well on my channel, I will continue to do them, but this video will be the start on how to document. So if you are interested in becoming a medical social worker, or if you're about to start your practicum and being a medical social worker or a hospital social worker, this video is applicable to you, and I think that you might benefit from it and learn something from it and take away. Comment down below anything that you feel like was good for you, or that you feel like might be good information for me to add in another video, or that just comment something so that someone else reading it be able to take something away, and we can all just be like this learning little community, like little geeks. I love being a little geek. So let's get right into the video. So I'm gonna open up my notes right here, and I ended up writing down some points that I thought were great for the initial video. So I just wanted to double check with that and make sure that I have everything organized for you guys. So it's right here. So I have 5 tips to help you document for a hospital social worker or a practicum medical social worker position. So if this is for you, then keep watching. But the first tip is you will need to talk in third person. Talking in third person is key in all notes when you're relating to social worker. You always want to refer to yourself in the third person. So the social worker, or if you're like me, sometimes I abbreviate social worker for SW or LMSW. A lot of people don't know what LMSW is, but they can kind of guess what a social worker is, especially because when you're at a hospital, your name will come up on the note, and your job position or title and license should also be attached to that little row as well. So that's what I'm referring to when I say SW or the social worker. And you can always in your note start off not using abbreviations, but say the social worker, spell out the social worker, and then after the social worker put in SW, so that moving forward in your note you don't have to write out social worker for the rest of the note. So talking in third person, the social worker met with the patient discussed. So it's like reading a book. I would suggest, if you're not a reader, to read a book. Open up a book and you'll see how talking in third person looks. Google it, and you'll be able to come up with a good way to make notes, good way to make things flow and make sense. But you want to write the note as if you're an additional person in the room with you and the patient, or you, the patient, and the doctor, so that another person who wasn't in the room can understand the dynamics of the relationships, can understand the dynamics of the conversation, and how you responded to the patient as a social worker, or how the patient responded to you. I also try to put the patient's name in the chart as well. So Jane Doe met with the social worker to discuss housing needs. So that is something that would be great in the hospital note. Social worker discussed with the patient, Jane Doe, what area she would like to look for housing. Social worker also discussed with the patient what type of housing that she was looking for or interested in. Social worker asked the patient if she was interested in maternity housing, transitional housing, residential treatment facility housing, or if she was wanting to try to move in with a family member or a friend in the meantime until blah, blah, blah is settled. You don't have to constantly mention Jane Doe's name like I did. You can say the patient responded to the social worker that she's interested in residential treatment housing after she has her baby. 2 weeks postpartum, she plans on graduating the residential treatment program, which will allow her to bring her baby there for 2 weeks, and then she plans on transitioning to her father's home, which is the address listed, and you list the address, and there you go. So you can go through that conversation word for word, you know, put in your quotations, but I think it's really key to make sure that you're talking in third person. So let's say that it's 3 people in the room, maybe 4 people. Sometimes I go into the hospital room and there's other physicians or other medical workers in the room when I'm meeting with the patient. I try to make sure that I include those individuals as well, especially if they stayed in the room throughout the duration of my encounter with the patient. So I'll say, social worker into the room of Jane Doe. Jane Doe recently gave birth to a baby girl on this date. When social worker entered the room, she was meeting with her RN nurse, labor and delivery nurse, and the lactation consultant. Social worker waited until the lactation consultant and the RN were completed with their encounter, and social worker inquired about how labor and delivery went. Jane Doe responded that her delivery went really well. Social worker then asked the lactation consultant if patient is able to breastfeed with her negative drug screens throughout her pregnancy. Patient was really excited and expressed her excitement to lactation consultant, RN, and social worker about being able to breastfeed for the first time now that she's achieved sobriety. Lactation consultant responded to patient that she was also available to meet with the patient later on throughout the day and provided her with her call number. Social worker then, lactation consultant and RN left room. Social worker continued on the conversation about baby needs, baby items acquired by the family, if there was any additional needs or concerns that the mother had. You can say mother, you can say patient, you can say her name. And sometimes I don't even put patient as in written out, but then I will use it as PT. So you need to talk in third person. Make sure that everybody is involved that's in the room, that you address the people that might have been in the room, like maybe the father of the baby was in the room and he was asleep on the cot, or maybe she had family members there. I would include family members were also included in the room throughout the encounter. So my tip number 2 is statements, not opinions in your notes. Also, don't assume patients' feelings for them, but rather describe their verbal and nonverbal responses to the conversation/info. So it's really important not to impose your own thoughts or feelings or assumptions about the patient's encounter with you. So if you had a really deep conversation or really interesting conversation that maybe went really well or didn't go really well, or maybe the patient is just overwhelmed by the current circumstances that she's dealing with and she became emotional is what me and you would say. It's good to not say that she became emotional, but to actually put actual facts in the chart. So nonverbal and verbal things are things that you want to include in that. So if the patient became emotional discussing children's division, you know, put that patient had multiple questions about the process of children's division, which social worker answered. After discussing the different outcomes that could potentially happen, such as children's division potentially taking custody of the baby going to foster care or going into relative placement, patient became, or Jane Doe became, tearful and really quiet, not super responsive to any additional questions. So you don't want to say that she became emotional, that she became irrational, because I'm really annoyed because I just filmed this video already and I just went back and watched the clip and it just stopped. Like, I was really confident and felt really good about this video. And then I have to like figure out where I left off at. I don't even know. These videos are getting like so hard. I just need to get more storage on my camera. Okay, take 2. This looks crooked, but I don't know if it is, but I'm over it at this point. So I was saying that you need to be as honest about your encounter with the patient. So you want to remember that they're human beings, and sometimes the patients actually have access to the chart or the documents, the notes that you write, that the medical team writes. And so it's really important to actually put what actually happened in that counter with that patient, so that if they review it, they don't assume that you were that you were having judgment against them, that you were lying or not being exactly truthful or factual with the information that you put in your notes. So if a patient became tearful, you can always ask and inquire, what is causing you to become tearful? What's causing you to cry? Like, what are your thoughts going on right now? And actually put those things in quotation. So that leaves me with my next tip, is to use quotations as necessary. So all of these things will mesh and work together to make a good note. So when you're meeting with a patient and the patient is becoming tearful, or even patients who become verbally aggressive or abusive, or even if they start to become physically abusive, you want to document things as they play out. So as long as what you can remember, put that in the chart. So if the patient is being verbally abusive and calling you racial slurs, put those in quotation marks. If the patient is telling you that they're not going to leave the hospital, put those in quotation marks. If the patient is telling you that they're not going to do something, if they're going to do something, if they threaten someone or threaten you, or say that they're not going to abide by the rules and policies that you've already laid down or are expected of them, put those in quotation marks. Make sure that you aren't assuming or piecing together what you think might be going on in the patient's mind, but actually give factual information. It is so important, because you don't want a lawsuit. You don't want things or documents to be used in court and then they're not accurate, or if there's a witness there, or things, or people overheard things and that's not how it went. Always be truthful in your documentation. Never try to make yourself look better or look more educated, but just give actual factual information. Make sure that what you say about the patient is actually true. Like I said, ask them, why are you getting upset? Is there anything that might have triggered you that I said? Is there a reason why you don't want me in the room? And include those things in the chart. So descriptive detail. Was anyone in the room? Was it a phone conversation? What was going on before or during the conversation? So I try to give as much detail if I met with the patient in person or on the phone or telemedicine, or if I met the patient walking out of the hospital or in the clinic. I include those encounters as well. And I want to make sure that the people who are reading the notes, like the doctors, the physicians, the pharmacy, the nurses, we're ran out of memory again. But I think it's good until the end of the video, okay? So let's move this along. This will be my third time doing this video. Truly my fifth, but we're gonna say 3. Trying to figure out where I left off. In the hospital or in the clinic, I include those encounters as well. And I want to make sure that the people who are reading the notes, okay, so I'll say that the people who are reading the notes need to be able to understand where the encounter happened, how the encounter happened. Like, was it at an appointment? Was it because I needed to go visit with the mom now that she delivered? I just kind of give more description about my encounter with the patient and why I met with them. So it might have just been for postpartum follow-up. Now that she had delivered the baby, maybe it was because of children's division question, or maybe it was to give her baby items and things like that. So I try to make sure that everyone in the hospital knows, like, they don't have to call me and ask me for questions. You want to put enough detail in there, but you want it to be clean, concise, and consistent when you write your notes. You don't want there to be a whole bunch of hoopla in there, a whole bunch of fillers, word for word what the patient and you said. That's not necessary, guys. It's not necessary. Include only the important, pivotal things that are important. So that's what I wanted to say about that. And document all and everything, especially encounters with patients on their behalf. So I sometimes get cabs for these patients. I sometimes will call their Medicaid insurance. I sometimes will schedule primary care appointments or PCP appointments. I sometimes help them find a pediatrician. I sometimes verify if they're engaged in treatment. I sometimes verify if they've been meeting with their counselor or their treatment center, or if they've been able to make it to their methadone and get their MAT. I sometimes get, UDS results from other facilities. I sometimes get other medical documents. Sometimes the patients have other agencies or organizations call on their behalf and just verify that they're actually getting prenatal appointment, or they're actually pregnant, or to collaborate on how to meet her needs or their family's needs. And so I document all of that. I document that I've made multiple calls to the patient. I made multiple calls to their emergency contacts. I had a release of information signed. I sent the release of information to whatever agency. I spoke with this person at the agency. They plan on following up, or I plan to follow up in a few days. Or I left a voicemail. I left a voicemail with brief information about who I am, or if they don't know me, or the purpose of the call with my information. I document everything, especially if it's even a brief encounter, like I meet the patient walking to the hospital. I wasn't even trying to meet with them or anything. And then I also will at the hospital, we also copy and paste whatever's in mom's chart into the baby's chart. So if this mom is actually now postpartum and she actually has the baby, we then will copy and paste whatever encounters are going on between the two patients. Most of these patients, notes from then on after they deliver will be confidentiality, because most of the time children's division involved, and until children's division has decided on custody and discharge planning, we have to keep all of that privacy, just because sometimes the baby goes into foster care, or there's a family member who doesn't want the parents to have access to their address or their phone number. So you have to keep all of that stuff private. So I'm gonna go over the notes again. So I'm gonna go over the tips again. So you will need to talk in third person. That's super important. Statements, not opinions, in your notes. Also, don't assume patients' feelings for them, but rather describe their verbal and nonverbal responses to the conversation or info. Descriptive detail. Include anyone that was in the room. That's including medical professionals. That's including medical professionals that you've talked with on behalf or for the patient. So you talked to the nurse, you talked to the resident, you gave the residents updates about discharge, you gave the residents update about the patient's mood or her concerns or her behavior. Include that information in the chart. Rather, include descriptive details about if it was a phone conversation, if it was a brief encounter passing through the hallway, if it was in the baby's NICU room, if it was 2 days and she was missing and now she's back at the hospital trying to care for the baby, if mom was slurring her words, if her eyes were closed, if she was leaning forward, if she was drooling. Include all of that information in your chart so that people know what's going on when you met with the patient. So that when a nurse maybe comes in after you, they're like, oh, so this has been going on for 2 hours straight that this patient has been like this, or this patient complained of this, hurting her, and she told the social worker, and now she's telling the pharmacist, and now she's telling the physician. So include all those informations and encounters that the patient had with you, with people in the room, whether they have family members speaking on their behalf, maybe a grandma's there and she's questioning why children's division. Include that. Use quotations when necessary. That's a tip. And document everything, like I said, especially encounters with patients. So if you called them a cab, if you called them Medicaid to ask about their insurance is active, if you called Medicaid to talk about getting them transportation. If transportation called and said that they are not able to pick up the patient and they have to cancel the ride, you have to document that, and that you called the patient and let them know that Medicaid is no longer coming. So it's important to document. Document is so important. It's probably the second most important thing in social work, because you have to have those encounters and then rapport with the patient, and then you have to document everything that you guys have worked on, those goals, treatment goals, progress, what they said they're feeling. You don't want to assume, like I said. Ask them questions about their feelings. Ask them questions about their nonverbal. Like, I had a patient who I assumed was becoming anxious after talking about, children's division and treatment. She starts twirling her hair. I mentioned patient begins to twirl her hair. Social worker inquired how patient was feeling. Patient says she was overwhelmed. Social worker asked patient if she was feeling anxious about going into residential treatment. Patient says yes, it's all happening too fast. Those are things that are important so that you can remember, because you're going to encounter so many other patients, you're going to encounter so many other things. A patient might come back a year later, and you want to remember what your type of rapport was, what their type of encounters were with them. And so I will be creating more videos, more tips, and just more actual examples. The next video in this series will be actual examples about my notes and how I write them, and then I'll try my best to show you how I write them. You know, I'll try different ways in order to keep this entertaining and informative to you guys. And yeah, I hope that you guys enjoyed. Like I said, I've been trying to record this for like 5 times and I've not been successful, but before my camera gives out again, I just want to say thank you so much for watching my video. If you guys have any questions, comments, or concerns about anything, please make sure that you leave them down in the comments. Nothing is a dumb question. And if you want to email me privately, I have an email address, and you can also reach me and DM me on social media. So all of that stuff will be listed down in the description box below. But I hope that you guys are doing well. There will be more videos, more social work videos, more documenting videos. And yeah, I'll see you guys next time. Bye.